President Trump has canceled a scheduled meeting this week with Democratic leaders at the White House, raising the possibility that for the first time since the end of 2018, the government could shut down next week. Our Joe St. George explains if that happens, how you could possibly be impacted.
The odds of the first government shutdown in nearly 7 years are increasing by the day. Government funding runs out in less than a week, and the House and the Senate aren't even meeting this week. So, because it's been a while, what happens if, in fact, the government does shut down? Let's start with Social Security checks. Medicare and Medicaid, all three continue uninterrupted during a shutdown. But other government services may be suspended, with some offices shutting down. With prime autumn leaf viewing on the horizon in many parts of the country, you may be wondering about national parks. Traditionally, they have been impacted during a shutdown. Roads could close and services may be reduced. A big impact, though, when shutdowns happen are paychecks for those who work for the federal government. Federal contractors, federal employees, and military service members are three groups to watch. Contractors can lose out on pay altogether. Full and part-time federal employees and military service members could face a delay in their paychecks. A 2019 law does require back pay when the government reopens, but that does not apply to contractors. The first shutdown impacted paycheck wouldn't occur until October 10th. That's according to the pay schedule for federal employees. The Trump administration would determine who is an essential worker and who is not. Essential workers would be expected to report to work. In 2018, during the last shutdown, TSA workers were deemed essential, but as Scripps News Group stations across the country reported at the time, there was an uptick in some employees calling in sick. And if you're wondering what is the political divide right now, Republicans essentially want the government to be funded the same until late November, with no policy changes to health care. Democrats disagree and are concerned premiums will rise for many Americans in the months ahead as Affordable Care Act subsidies expire.
If Chuck Schumer intends to shut the government down, I don't see an easy route out of that, and there's going to be a lot of pain.
Our position has never changed. We need bipartisan legislation to keep the government open and meet the needs of the American people, especially on costs, specifically health care costs.
Joe St. George, Scripps News Group, Washington.